the purpose of this today, I chair the Lewisham Commission group.
Briefly, could you first of all describe who your patients are, the patients that you see day in, day out?
I see genuine residents of Lewisham, that's all the GPs do. And I think one thing, as I said right at the beginning, I've been a GP for a long time, and that means you build up a really good, close relationship with your patients. And also you know the sort of lives they live and what services that they need. And that's why I stood for this position, because I felt I could speak and stand for the people of Lewisham that I work for.
What has been the effect of the CCG?
The CCG, I mean, we've only really been live since the 1st of April this year, but actually we ran in shadow form last year. And one of the first things we did as GPs when we started was, what difference can we make quickly? Where is Lewisham not doing as well as some other places? And one of the things Lewisham was not good at was vaccination of their children. So we looked at this together, we worked with our colleagues in the council and the Hospital Community Trust, and we went from being almost the worst CCG in London to being in the top part of London, and the actual increase was 10%. So we went from something like under 80% of our children being vaccinated to almost 90%, which is in about 6 months, which shows when we work together what we can do.
Now, you've raised the decision of the Secretary of State in detail. What do you see as the most serious ramifications of these changes?
One of the reasons that we continually throughout the whole process objected to what we saw was going on was that we saw what would happen to Lewisham would be a breakdown in services. One of the things that Lewisham is really, really good at is working together. We've had lots of speakers today talk about how we work collaboratively. The hospital right at the centre has been a part of that. If you take that hospital out, what happens is that we're then having to work with 4 different hospitals. It doesn't really matter how good or bad they are. You can argue about what the process might do to those hospitals, but even if they're the best hospitals in the world, if I as a GP have patients in 4 different hospitals, they have to know 4 different procedures, they have to deal with 4 different sets of social services. It's all incredibly fragmented. And Dr. Sikorsky was talking about fragmentation in mental health services. This process will mean fragmentation in paediatrics, in care of the elderly, in all sorts of things. And it may be that there are a few certain conditions that are looked after better, we know that's stroke and heart attack. The majority of people don't have those sorts of things. They have simple things that just require a day or 2 in hospital. With my patients end up in King's, I don't get discharged somewhere, I don't know they're even there, and I don't know when they come home. If they went to Lewisham Hospital, I know they've been there, I get discharged from the A&E, so they're in hospital, I get discharged when they come out, and then I need to go and see them to make sure they don't go back in again. That sort of thing's really, really important. And I know the doctors at Lewisham Hospital and they know me, so that we can work together. There is no way that I can know all those different doctors in all those different hospitals, and so my patients absolutely will not get such good service.
And what about travel times? How will the change in travel times impact on residents and their carers?
Well, I think we've already heard the impact from different individuals about travel time. One of the things that we said clearly throughout the process, we argued intensely about travel times, is that whatever it says on paper, it's what people want to do that's really important. When they do maps of the east of Lewisham, all those places are going to go to Queen Elizabeth, and it will take them that length of time. Well, so actually going to go to King's, it's going to take a whole different length of time. And we know that's what patients will choose to do. So the impact is huge because the travel is costly, it takes time, you don't necessarily visit your relatives as often, so they don't get as well so quickly, so there's an emotional impact. But actually we think the argument about travel times in the theatre is completely flawed. And we made that point over and over again. It was what the picture of health, which was the previous manifestation of this, fell down on when they actually looked at it. And they realised the impact of it would actually be to overburden Kings and Guys and not solve the problem.
Now, I want to ask you
in advance notice of what was going to be discussed, and we said we had no papers to look at before we got there. So we were presented with documents and a very quick piece of this is what has to happen, without really getting the chance to contest things. If we did contest things, we were just told there's no time to discuss that, this is the only possible solution, there's no time to look at anything else. That was a consistent statement throughout the whole thing. And often we weren't even allowed to take the papers away to look at them afterwards. It was that type of process.
Right, amazing.
So, in reality, ignored. In reality, ignored. Your
Yes.
The Secretary of State claims that the proposals have clinical support. What do you say about that?
Well, I think it's already evident from other people that they certainly don't have Lewisham clinical support. From my colleagues in other CCGs, the other CCGs are obviously in a very different position, and so you shouldn't be too surprised that if their responses were different. But all of those responses clearly stated that they had significant concerns that needed to be answered, and they were also saying that throughout the process. Colleagues in Southwark concerned about the impact on King's College Hospital, colleagues in Bromley on the crew, and none of those questions have been answered. So again, they've just been brushed over. So no, everyone's happy, this is the best thing since sliced bread.
Now,
Tab 2, please, of that bundle. I think it's there in front of you. This was written this year, 30th of January, where the director was being asked to consider various aspects of the TSA's recommendations and so on. And consensus was a factor that was being emphasised. And I want to ask you about the second page. Is there strong evidence of sufficient clinical input? Do you see that?
Yep.
Right. Now I want, before, as a precursor to what he wrote to the Minister, I just want to ask you what is in your statement in detail. It's on page 85 for those who want to follow it. You've said that the Secretary of State claims that the proposals have clinical support. We've shown overwhelmingly in Lewisham that there is no local support. 160 GPs signed a petition against the proposals. A further 140 GPs from other CCGs also put their names to this. The hospital clinicians have produced effective clinical arguments against the changes, and then you mentioned 25,000 people marched on the streets. Then you say the other 5 CCGs in South East London have each expressed reservations regarding the outworking of the proposals. Now you go into more detail. That's your, as it were, description and narrative. Now can I just turn to what the Minister was told? Under this heading, is there strong evidence of clinical input? And I really want you to just make some observations on this, if you wouldn't mind. I'll just read it so that everyone in the audience knows what the Minister was being told by this review. I can confirm that there is strong evidence of wide clinical input. Operationally, the TSA programme was supported by a clinical advisory group led by a local GP, Dr. Jane Fryer, which built on 2 years... I'd ask for a little restraint. Which built on 2 years of preceding clinical engagement. This group included 8 trust medical directors, 6 clinically qualified CCG chairs, the London Ambulance Service medical director, the local director for trauma, and 3 directors of nursing. An additional external clinical panel, chaired by Professor Chris Welsh, medical director for Midlands and East of England, provided additional scrutiny and challenge, including from the Royal College of Midwives and the Royal College of Obstetrics and Gynecology. Now there is more in this list. I just want to ask whether in fact this is a misdescription or whether there's any truth in it whatsoever.
First off, I don't know about the 2 years of preceding clinical engagement. It may have happened, but it didn't involve me, so I don't know anything about that. These people were all at these meetings. I was at those meetings, but the point was that when points were raised which went against the current dialogue, they were ignored. So they were there. The other point I would make about the external clinical panel is that it was made up of specialists who had specialist interests in specialist areas. There wasn't anybody from the Royal College of General Practitioners, there was nobody talking about integration of services rather than fragmentation. So you could argue, yes, we must close the section of Lewisham Hospital, which you haven't got the right to do, and you might get this problem. But what about everybody else is having normal deliveries who then have to travel with lots of consequences on them? There was no counter-argument. There was only the one thing always, the specialist need and money's need. There was nothing about integration, there was no input from the Royal College of General Practitioners.
Final question. Is there a record kept of these meetings?
They were all limited.
Is it available as far as you're aware?
CSA must have it. They were all limited.